how do we maintain the order of hospital systems, secure hospital networks, and keep our health systems up to date to the benefit of the public? Buckle up and be with us today as we explore another field of public health. Hello and good day, I am Rupert, and today we will be having another trip to another world, which is a very important segment of public health. Welcome to the second episode of Trip to the Future, this time with health policy and administration. As we journey to the future for this episode, we have a special guest, an esteemed faculty from the Department of Health Policy and Administration. She's currently the Associate Dean for Research of the University of the Philippines College of Public Health. She's also working as an independent consultant in different areas and has worked for various agencies such as the Department of Health, PhilHealth, Philippine Council for Health Research and Development, UNICEF, and World Health Organization. She is also a founding partner and the former executive director of Alliance for Improving Health Outcomes Incorporated, a nonprofit consulting and mentoring organization that works with government and partners towards strengthening of Philippine public health systems. Grabe, long as it may seem, that introduction still does not give justice to the achievements that our guest, very accoladed guest, has achieved in her life. This person is such a lodi, as millennials say, in this field because of her achievements and what she has worked on. At this juncture, let us welcome Catherine Ann V. Reyes, Doctor of Medicine, Master in Public Policy. Hello, Doc Kathy. Welcome to the show.
Hello, everyone. Hello, Rupert. Thank you so much for that kind introduction.
Yes, but we are very much honored to have you with us on this week's episode. But I think before anything else, since not all viewers are from the College of Public Health, maybe know po kung what exactly do you do in this field? Maybe a little introduction apart from what I have stated earlier.
Okay, so good morning, everyone. As Rupert said, I am a licensed physician, but I actually stopped practicing clinics long time ago, but I've never left the heart of what medicine and healthcare is all about. So what I do in health policy is basically look at the overall decisions around what makes people healthy and provide evidence as well as understand how decisions are made so that we could influence those who actually have power to make decisions over the lives of population. So that is what I do. What I've been doing for the past 10 years. And recently I've entered the academe. So now I teach. So what I've learned, I'm now teaching that to our students, transferring what I know, and also currently being more involved in research. So it's providing the evidence to the decisions that are being made in the healthcare sector.
Yes, ma'am. Thank you so much. Really passing on your knowledge to the future aspiring public health practitioners. Thank you so much for that, ma'am. Actually, I have reviewed your curriculum vitae and I see that, wow, it's 7-page long. And I must say, it left me in awe. But I think one of the many things that struck me the most, ma'am, is that you actually graduated BS Biology cum laude from the University of the Philippines, Manila. And
Diliman. My professor might get mad at me.
stand corrected, UP, University of the Philippines, Diliman. And right after that, you actually enrolled in the College of Medicine of the University of the Philippines, Manila. Ayan. So my question, ma'am, is how did you, or what's the calling, or how did you veer away from the art of biology, from the art of medicine, which is more on patient, doctor to patient interaction, into a public health, into public health arena, which is more towards population health? Can you tell us how did you end up, or what made you want to pursue a career in health policy and administration?
All right. So probably starting off from all of your perspectives. So you're now undergraduates and thinking about your future, right? So when I was in biology, one of the reasons why I was there was really to go into medicine. Not exactly my first choice, but that's what my dad wanted me to do, and they said that biology is like one of the best pre-med courses, and that discipline really helped me a lot in terms of being critical, the scientific process, and understanding the order, let's say the order of things. And that kind of thinking was very helpful when I went into medicine. And in medicine, of course, they train you to focus on a person, as you have mentioned. But I think the nice thing about it is that when you go through all this training, you become conscious about what kind of skills actually excites you in terms of learning it and then practicing it. So my appreciation looking back is that I really appreciate the process of understanding a problem, really knowing what it is, and then looking at the tools around you and trying to see how best to solve it. So that kind of appreciation was cultivated during medicine. So you begin to really appreciate, but now your subject is, let's say, the human body, and you begin to understand the pathology, the abnormal versus the normal. And then understand what kind of tools will help you manage the problem. So that's the kind of skill set that you get in medicine. So I actually proceeded to residency, not exactly because I know that I really wanted to subspecialize, but then at that time during my era, so to speak, and even those before me, that was really the option. Like, if you go in medicine, you're expected to subspecialize. And if you don't do subspecialization, the notion usually is your career is doomed. Like, okay, so what are you going to do with your life? You're just delaying life, you know. So if you want to move forward with your career, go right ahead to subspecialization, go done with it, and then start your practice. So I chose pediatrics because I think that what spoke to me the most. I like, looking at child health, and I like taking care of children. So I went straight away to residency training in PGH, and for me, the striking thing when I was doing my residency was, on top of understanding the problem of my patients, I was really so bothered about the fact that a number of them would come back again sick. And I would never forget one of the most striking experience of my career when a consultant asked me, how are you going to send that baby? Because I was so excited, okay, this patient is about to be discharged. This baby will go home well. She's okay. And then she asked me, do you know the kind of home that she'll be going to? Have you checked on the mother? Have you checked on the environment where you will be sending her home? So I was taken aback. I said, I've done my job. Okay, so now I'm going to send this child home. So are you now asking me to like spend time away from my other patients just to, send her home? But then, of course, that's your consultant. So I followed what she said. And then I went to the mother, and lo and behold, I found out that she is really sick. And of course, I have to investigate. I asked about the household and all that. And it's just the condition of the baby would actually require me to check on everyone. So I have to bring everyone to PGH and all that. So that entire experience actually opened my eyes as a clinician that, the problem of my patients is beyond the walls of the hospital. So that's when I started to be really aware of all these things. And I'm not sure if it's the positive or the negative side of it. I got really frustrated about everything. And I was brought to a point that I said, I have to get out of here and see what's happening and really have the tools again to understand what's the problem. I have no idea what public health was. I have no idea what health policy was, but I quit residency. And I don't know exactly what the next step would be. And the thing is, during medicine, when I was doing my medical degree, there was this doctor who would keep on mentioning to us about public health, about determinants of health, about community health, and his name is Dr. 𝗷𝗵𝗆𝗆𝗏. So when I went out of residency, I think for me it made sense to reach out to him. So I asked him, what are my options? So these are the problems that I see. And I think these are the problems that are now speaking to me. So I want to understand this more. I want to have the tools to know and to contribute to this um, problem. So he led me to certain people. So I get to talk to some people, and eventually it landed me my first job outside of residency. And it's actually, if you would consider, like if you're a doctor, sometimes they give you that sense that, okay, you're now a doctor, now get to lead a team and all that. But my first job was that of an RA. And I think if some of you are knowledgeable, the research assistant is like in the realm of public health, maybe, or realm of development world, that's like an entry-level job. And it's like the lowest position in the totem pole, so to speak. So it
Yeah.
was pretty humbling. And that's actually how I started to get to know what health policy is. And exactly, even at that time, I don't know that that field exists. I don't even understand what public health was. But I just understand the kind of problem that motivates me to learn more and to be able to contribute to. And that started my pathway to health policy.
Yes, ma'am. Thank you so much for that very inspiring story of yours. The calling, it's very interesting that the calling actually happened when you are when you're starting practicing the art of medicine already. And wow, it inspires me also because you never know when you would take a leap of faith. And you did that, Mohammed. Now, looking at your CV, you've achieved a lot from this field. And I'm also happy, ma'am, because really being in BS Bio or being in Doctor of Medicine, you really would one way or another practice or acquire the skills necessary for you to practice in this field, knowing what the problems are, recognizing the problems first, and offering solutions to that. And that is, I think, also the very heart of health policy and administration. Thank you so much, ma'am, for sharing that to us. Now let's go to somehow a more going to some of the technical parts of health policy and administration, since we know that health is political. Of course, parang it's given already. And I believe it requires interaction with the government and policymakers. And the government and politics also get in there. How do you manage and compromise? You still get to work on this job well by creating policy recommendations and the like. Despite some of the contradictions, some of the struggles probably, or some of the parang discouragement from the current system that we have right now. How do you um, how do you conquer those, ma'am?
Okay, so I would usually tell my students that the preparation for health policy work starts during your training. Um, at the onset, if you first you need to understand, as you mentioned, that this kind of work will really expose you to the politics, and politics really is all about the exercise of power. So eventually, someone in that room will have more power than someone else. And a lot of decision making is really dealing with that power. I mean, it happens in our daily lives, right? So when decide on something, someone is about to exercise power over someone. It's just that what we are concerned about this in health policy, because number one, it impacts a lot of people. Like a decision can really impact a lot of people, not just now, but even in generations, because sometimes we don't know the consequences of our decisions. That's why we really need to study it. Number two, a decision that is made in public health involves money. So when I make a decision towards one direction, it means lesser money for others, right? So um, that's why decisions are very important, and that's one thing that we really emphasize, and what our decision makers we would like for them to really know. So getting into this field, you will know that you will have this kind of tensions around you. So number one, if you are really decided that this is a field that you want to get involved with, maybe not 100% of your work, but maybe some part of your work, you know that you want to deal with this, you want to engage with power, you have to be very clear about your ethics and your values. So you know where to draw the line, um, you know when to turn your back, you know when to, as you would say, compromise. I'm not saying it's really compromise, but it's knowing how you could stretch the agreement, such that, okay, you attain some degree of success, maybe not 100%, but then you know that no one is harmed in that decision. So you have to be very strong about your ethics and your values, and you know what you bring into the table. You also have to be very clear about your boundaries. So at the onset, you need to be very transparent about that to your partners or to the people that you deal with, that this is the interest that I represent and these are the boundaries that I represent. And and also, third, very important in this work is really relationships, because it's very difficult to influence decisions just by saying, okay, I'm the smartest person here, or I have like the best data or the best research here. No, you actually influence this by the kind of relationships that you establish with them. They know that they can trust you. They know that you also have the interest, let's say, of the people. You carry that with you consistently in your work. So I guess it's, these are like the most important things to consider for you to be successful in this field. No? So number one, be clear about your values, be knowledgeable, be very upfront about that. Do not compromise, because once you compromise, it really affects how people will look at you. Be very intentional about the building relationships in the sector, and also being very clear about your interest as well, and the boundaries that you set around you.
Yes, ma'am. Thank you so much for that. I actually agree with you, ma'am, with the three things that you have said. One, to know your values, know your principles, know your boundaries, as well as really building relationship, because it is essential for us, especially that public health is people oriented. Thank you so much, ma'am, for that. Now, to give some of our listeners some, an overview of some of the challenges in the field of public health. My question is, what are these? What have you experienced in your very long journey towards practicing health policy and administration? What are the challenges that you see, that you have seen, especially in the Philippines, that we must overcome?
First, I like to deal with the practice side of it. So being a health policy specialist. So in the Philippines, this is a fairly new recognized field. In fact, when I was starting, I was telling you, like, if you would search health policy at the time, let's say if you're looking for a job, it will always bring you to like insurance policy. So it's not exactly the kind of job that you're thinking about right now. So number one, the field is fairly young. So even here in the Philippines, there's only very few of us who were formally trained in public policy, much more in health policy. So that's what I think, the field is really new. So and when it's new, and then there's a clamor for the skill, then of course ultimately other people will either try to say that they are also health policy specialists. So it in a way it blurs the identification of the field, compared to, let's say, we say I'm a doctor. It's very clear to validate that if you are a trained physician or not. So I think that's one. So the practice, it's still new, it's still evolving, and therefore, in terms of opportunities, you have to really look for it. It's only fairly recent that government has started to really identify positions that are meant for policy trained people. So it's the same way also for the private sector. So now that they're recognizing the importance of the field, they're now starting to put positions. So for you to practice the field, I think somehow that has been addressed. So it's fairly growing. So in terms of opportunity, it's there. Now on the other side of it, like interacting with the client. So of course, the practice of the policy has a lot of it's shaped around the environment where you practice it. So if you are heavily involved in the practice here, and you are not confining yourself as a researcher, because you can do that. You can actually do policy research and do not interact with the policy making process. That is possible. But for me, it somehow, I mean, at least for me, it constrains your practice, even your understanding of the field. So you have to interact with the policy making process. And the experience of that can either, of course, be positive or negative, depending on the regime. So in some parts of your career, it's good. If you're engaging properly, you're actually seeing what theory tells you to see. But at some point in your career, you can expect it can be very difficult. So that, I think, is something that comes with the territory. So yeah, so number one is the practice. Number two is interacting with the policy sphere. And that can be very dependent on what is the political climate at the moment.
Thank you so much for that, ma'am. And it's somehow a good news that the government is now starting to recognize the importance of health policy and administration. And I believe that's also because of COVID-19 pandemic, since it's a very problematic health crisis that we are currently facing right now. But going back, ma'am, to your CV, you've mentioned that I actually see, ma'am, that you've worked in different areas of policy. You have worked in you have experience in governance and regulation, social health protection, health program, and even outside this realm, you also had advisory roles, professional experience, management experience, all these things, ma'am. My question now is, can you describe to us your experience working in this field, so as our listeners would have an overview as to what career opportunities they may get from health policy and administration?
Okay, so as I mentioned, it's not all the time that you will see, the job position saying that we actually need a health policy person. It's very rare. And you're happy, like I probably in my career, you'd probably see that post going out maybe twice a year or something like that. So it's not all the time that you see that post specifically for health policy. But what I think, not just in field policy, but I think in any kind of training that you go to, is that you have to be very cognizant about the skill sets that you have and what you can do and how else you can grow that in a certain kind of job. So as I mentioned, health policy is really about understanding how decisions are made, how to influence that decisions, and how to drive that decision to be influenced by evidence. So that's one aspect of the practice, the field. So it's really working with people and making sure that people actually look at evidence, appreciation of evidence. The second part of it is, as I mentioned earlier, is the problem solving part. So I need to be able to understand what the problem is. And in health policy, it's not just you understanding the problem, it's you understanding the problem together with a client, with whoever you're working with. And then coming up with the evidence to actually provide them with options that will not harm or not cause the less harm if ever there's going to be some harm that's unavoidable. And then the third part of it is you actually generating the evidence that, hey, this is a problem, or yes, this is a problem, and these are the things that you need to do so that you can solve that problem. So there are actually a lot of researches that you can do along the policy decision making sphere. So as an analyst, I know, for example, at this stage of my career, this is the kind of skills that I now have. So therefore, there are actually a lot of positions that will need that kind of skill sets. So if you will scan, usually the job ads, they will say we need an MPH graduate or a BSPH, a MPP or a policy graduate, or with a management graduate, because they know that these are the kind of training that will give you that competency. So what I do, for example, if I look for opportunities, number one, I need to know that the value of that organization is something that I also connect with. So usually the UN agency, United Nations agencies, for most part, at least at the moment, for most part, I would agree with their values, with the kind of values that they do. So usually the health part of that, so that's WHO, UNICEF, UNFPA, these are the UN agencies that have a lot of health positions. And more often than not, the skill sets of a policy analyst is needed in this organization because they are advising organization. They advise government. So at some point in their technical ranks, they will need someone who knows how to look at data and come up with recommendations. Or they need someone who can talk to government, who can liaise with government and manage government relationships. So UN agencies, of course, because that is their mandate, they will need people like me in their ranks. Development agencies working in health, for example, USAID, non-government organizations who have health portfolios like World Vision, for example, let's say Plan International, or these organizations that have health in their portfolio. At one point or the other, they also need people like me who can, again, work with government, advise government, who understand health issues, understand the technicalities of it, and then bridge the mission of the organization to solution making. So that's the other part. And of course, the main source of clientele will be government. Because right now, actually even before COVID-19, I think this started during the start of the discussions around universal healthcare. So they started filling up positions wherein they need people who understand what public health issues are and actually look for evidence that can come up with solutions. So in fact, let's say in the Department of Health, there's an entire bureau there that is working on health policy development. And aside from that, in each of the program, there are positions there where people who are like me with my training can actually come in from mid-management to director level position. And of course, there's also the academe, because there is a demand for the job, they need someone to teach. So there is also academe. There are also other independent research institutions who conduct this kind of researches, and they also need people like me, or even I can start an organization like that. In this time and age, actually, there's no limit, really. Number one, because the problems are there. So as long as the problems are there will always be demand for solutions. Second, solution making is already without border. Like I can provide technical assistance to any part of the world needing my skill sets. Like I've been in collaborative projects because they need someone who has expertise in the Philippines. I work with people because they need someone with expertise in policy systems research. And I am just here in the Philippines. I don't need to go out of the country. So there are a lot of options. It's really a matter of you knowing what you can do and how you can harness that further in an organization that can also help you grow.
Yes, ma'am. Thank you so much. I like it that you say that the opportunities and careers that we can get here in health policy and administration, it's practically boundless because problems are always there and solutions we can provide solutions to these problems. I'm just a follow-up question, Doc. I think our listeners and me personally get quite particularly interested in that you've mentioned World Health Organization, and I believe you've also worked there. Yes, Doc. So can you tell us a little bit about that experience working in the World Health Organization, probably your roles there?
Okay. So right after my graduate degree, that was my first job in World Health Organization. It's should I say? I think that the entry point for World Health Organization, it's not very easy, which means it's not all the time that you can come in because you also the opportunity has to be there. And also to speak right, and everybody knows this, that WHO doesn't exactly have a lot of money, right? So they also rely on the fundings given to them by government. So that actually makes the opportunities, especially for full-time permanent positions, very slim. So for me, for example, I went there as a project coordinator. So there is an opportunity at that time to work on emergency, because actually in the Philippines, that's one of the largest portfolio that they have, because this is a country where you have a lot of emergencies every year. So for WHO country offices around the region, I think that will be their biggest portfolio, the emergency and humanitarian action. At the same time, so usually they have projects, and these projects will need people who can come in, fairly new graduates, which means they can still afford to hire you at a certain rate of salary. Because people sometimes have expectation that WHO, okay, that's high salary because it's WHO. That's not, I mean, I think relatively compared to other industry, yes, but in the general scheme in global health, that's not exactly the case. And also to be upfront that most of these positions actually are contractual, no? So which means that you don't exactly have the guarantee of job security, throughout your career. So it's not exactly for everyone. I think it's for a certain stage of your career where you can still, be a little risky in terms of your job choices and options. So at that point in my career, I was fresh off from graduation, and I was really exactly targeting positions like this. So fresh off from my career, I did not jump into the first job that was offered. I was very intentional about the kind of work that I will put into my CV. So meaning I really wanted to build a portfolio. So what I liked about the WHO post when it became available, and before I go there, actually, that job came to me through my network. It wasn't advertised. So as I was saying, usually in this kinds of jobs, you really have to look for it. You have to make yourself. You have to make it known to your network that I am looking for this kind of job. And that position was offered to me through a network. So they knew that I this is my training and this is the kind of job that I do. So my first job at that time was coordinator for emergency and humanitarian action. So my specific role was to work with the health cluster here in the country. So whenever there's an emergency, I will coordinate the action of my team with, let's say, other counterparts in the UN family here in the Philippines. I was also, so that again, coordinating skills. Second, I was tasked to write situational reports. So it's digesting the technical report and coming up with a summary that will tell the stakeholders of WHO what they are doing in the response. So it's actually very far from what I expect. I wanted like a technical job right away. But because I was just starting, they want me to be familiar about what they're doing. So most of the tasks at that point, you'd say maybe very junior, like I would summarize things. But what I really learned more, actually, than the writing part is, number one, that gave me an opportunity to understand the landscape of the stakeholders in the country while doing my job. Second, that exposed me to the people who are actually making decisions. So I begin to see and understand their perspective and how they make decisions. And thirdly, it actually also really taught me humility in terms of how to work in public health. Because I think most of my physician friends who are now in public health will agree to me on this. Sometimes the clinical work and world, being at the top of the team, gives you sometimes this sense of, pride and all that, because, I'm the leader of the team. And I think maybe in the hospital environment, it works. But for public health, that will start the failure of your job. You need to learn to work with people, and you need to really, be humble and learn from everyone and work with everyone. And when I say everyone, really everyone, like from the bottom of the ranks to the top of the ranks, and from your colleagues. So in that job, you asked me what I learned. Really, in terms of skills, I've actually so in terms of skills, I'll start, of course, from the best. So I've learned to work with stakeholders. I've learned to see how people decide, because it exposed me to decision makers. I've learned to collaborate with the team. I've learned to multitask because aside from my work, because we are a small team, as I said, WHO really has really a very lean team. I was able to do jobs that were not exactly part of my terms of reference. Um, so that was really a skill. And also part of my job was preparing the manual at that time for Safe Hospital. So I was also able to do a technical work. But on top of that, I've learned how to operate a Xerox machine, a copying machine. That's a very technical machine. I've learned how to send it through email, wireless. I've learned how to balance the books of my project's budget, so to speak, because I have a budget for me to be able to do my job. So they give me this budget, but you should be able to deliver this. You should be able to do all these trainings. So I was able to balance the book and do all my deliverables. So that's where I really started to hone my management skills. And at the same time, I've also learned how bidding process works, how difficult it is to transfer money from non-government to government. So these are skills that I couldn't have learned elsewhere. So that was, I think, the summary of my WHO experience before I transferred to a USAID project.
Thank you so much, ma'am. That was a very humbling experience in the World Health Organization. I believe you've enjoyed it because from being able to learn how to operate a machine to being able to learn how people decide how they do decision making. That was very humbling, very fun, very fruitful, I must say. Thank you so much, ma'am, for sharing that experience to us. Now let's move to a question that I think some of the BSPH students are asking right now, especially that the BSPH program is new. We are implementing a new program for BSPH students. Specifically, the college is now offering tracking, professional tracks, specifically medical laboratory science track and population health track. Now, since health policy and administration is centered or is focused on population health track, I think an essential question for here is that would there still be opportunities for those graduates or those BSPH students who took medical laboratory sciences in the field of health policy administration?
Okay, so as I mentioned earlier, the policy and administration revolves around decision making, working with the politics of things as well as management. So for MLS, of course, you are highly trained on the laboratory skills, right? So that's the first skill that you carry, and that's the first skill that you will hone, you will build on, and if you are really on the track, then eventually you will find yourself in the lab, right? Leading laboratories, supervising teams, and that's a very important work. If as a leader now, because you're a leader of a lab, so as I told you when I was doing my work in WHO, because I have to manage a small project money, I need to learn how to be, a good steward of that. Make sure that I attain my deliverables on time and deliver my output as I promised, because that's my contract. So when you do your work, especially for you guys, you are from UP, you are trained in UP, and then you will be expected to lead. I tell you that, whether you like it or not, it comes with your training. You are expected to lead. So to do that, you need to have all the opportunities and all you need to learn the most out of all the opportunities that you can get. So even if you're tracking, let's say it's MLS, and say, no, I'm just in the laboratory, do not neglect your management training, because you need that in order to manage a grant. Like if you want to be a leader of a laboratory, you need money. And I tell you that money will not always come from this government. Most of the time, that money will come from grants elsewhere. You will apply for grants, and for them to trust you with multi-million-dollar grants so that you can be like this great, esteemed researcher that you want to be, you need to demonstrate that you can manage that money, that you can actually deliver results, you can publish your studies, that people are happy working with you, and all of these are management skills. Now, if you want, as a laboratory leader, right? A leader in your field. You want to influence how your results will feed into saving lives. You will need to interact with decision makers. You will need to interact with people at the DOH. You need to work with people, giving the price of the laboratory product that you produce. So that part will need political skills or your policy skills. Now, you don't have to do that work 100% of the time. I think a very good example, let's say, is Chancellor Padilla. Chancellor Padilla is in genetics. That was her main job. That was her main skill. Now, she found herself in the crossroad that, okay, do I maintain this as my lab, research work, or they actually want to get it out there and influence the practice of using genetics as a means to, reduce mortality or reduce morbidity. So, part of her career is a training in health policy. She actually did masters in the College of Public Health to get that skills, that training for her to engage with policy making. So you will never know at some point in your career when you need that skill. So for the bachelors, do not neglect your management training. I think you don't have a lot of policy training yet, maybe just an introduction, but you do have a good training in management. So do not neglect that. Now, if you find yourself there in your career that you want to influence policy making, then maybe that's the time for you to actually get either a master's, a professional master's like the MPH, which is just a year, or maybe even certificate courses, short courses that will give you that skill set to do that part of your work well. So there are options and possibilities for MLS as students, especially for you guys, because you are expected to lead. I'm telling you that right now. So you have to get ready for that.
Thank you so much, ma'am, for that. Indeed, MLS or population health, health policy and administration can offer countless opportunities for us. Now, you've mentioned, ma'am, something about grants, something involving money. Now, my next question is actually about that. Since we can't deny that salary or money in general is a big part of our decision in if whether we're going to venture in health policy and administration. So can you give us an idea on the financial aspects of working in health policy and administration in the perspective of being a worker there? Like, are we getting, is this field somehow lucrative enough, especially for those students who are consider themselves as breadwinner of their family?
Okay, very good question and very important always to consider when you do your work. So I would always look at that question in relation to your life stage. So when you are just starting off in your career, and you probably have like you need to contribute to your family, but maybe not a lot. Like your focus at that point in time is building your career. It's building your portfolio, starting off where you really want, trying to just explore where things are. You could expect as a trained specialist, and usually you will be called as a policy specialist once you have that master's training. So you need that. From bachelor's, no, because you don't exactly have that many units in policy. But you will need a master's training to really start off as a policy specialist. But usually policy schools, for instance, will need you to have like training first. So you need to get a job before you go into master's school. So the usual available position as a bachelor is, let's say, an RA, research assistant or research associate. And I would say that most projects in health policy requiring this position would offer a decent salary for a starting RA or research associate. Now, once you have your master's, of course, you now have more bargaining power in terms of salary. It now depends on where you really want to work. Because as I mentioned, this skill set actually is boundless. Like you can actually go work abroad right away. I'm not kidding. because the opening of this job is you can actually get a job anywhere. Like for me, once I even before I graduated from the Lee Kuan Yew School, there were already opportunities for me to actually stay in Singapore. Except that I really wanted to come back, and I really wanted a specific kind of job for myself. So there are options, and it depends on where you want to work. Of course, if you go abroad, the pay will be higher compared to where you stay if you stay in the Philippines. But if you stay in the Philippines as a master's level trained policy practitioner, the positions that are offered to you will as far as I know, will always be decent. It will always be decent. Okay. Now, the good thing about this practice, and it also depends on where you work, you can actually do other projects at the same time, because the lifetime of the project can actually overlap. So for example, when I stopped doing full-time work, so my work in WHO was full-time, which means I cannot do anything else except WHO. I can do other things, but it's a pro bono thing. Like I can teach maybe a few hours. It's pro bono, you ask permission for that. So my salary is like my WHO salary. So when I did a USA project, it's the same time because it's a full-time work. Also, the pay is decent, I must say, given the position and training. So it's commensurate to what I would expect from that position. But when I left that as a specialist, I can actually take an independent projects. So depending on how much you can handle, but I must say that at that point in time, you must know how to haggle your rate. You must know how much your hours is worth, and start building your salary credentials, so to speak. So demonstrate that you can actually do work, and later on negotiate a higher pay and higher pay per hour. So at that time, when I was doing consulting work, I was actually earning more than what I would earn as a full-time staff. So I was earning more of that, but then I never stopped learning. So during that time when I was doing independent work, I was doing short courses. Sometimes I would go away for like a month to do a short course, really filling up my toolbox, so to speak, so that I can qualify for other projects. And then when I co-founded this nonprofit organization and really formalized our consulting work, I was able to take in more work. So so I was doing mostly consulting work. So that also enabled me to do some pro bono work, because I was okay. I mean, it's not like you earn multi-millions in terms of, if you're, let's say you're in the industry, but I was doing okay. I was doing well. And when I went into academe, aside, because I think the UP Prof salary it's there. You can Google it. You know how much we earn as UP Prof. But aside from that, the system actually allows us to take in grants. So we apply for grants, research grants, either local grants, international grants, and we of course get some honoraria from that work. It depends where your grant is. Some grants can actually allow you to get more honoraria, especially if it's international grant. Local grant, it's very limited. It's very, very small, but I mean, it's okay. It's additional money for you. But really, it's the international grant that can really help you. At the same time, we are also allowed to take in consulting work outside of our working hours. So you can also do some projects, but it should also be consistent with what you are doing, so that you don't really stretch yourself too much. So it depends where you are in your career ladder and what you want and where you want to work. So what I described to you is a typical trajectory of in health policy, but there are actually options for you to go in the industry. Because the industry, when I say industry, that means pharmaceutical industry, milk industry, tobacco industry, or the industry we call in the public health as industries, so that which matters to public health. There are positions there. So I have had colleagues who work and they pay, of course, the pay there it's really high. So they do just one job. They don't need to do multiple assignments. They do just one job and they earn equally or higher than you. But of course, their job is different, but they require the same skill sets.
Thank you so much, ma'am, for that. Indeed, being in the field, health policy and administration opens us to a lot of opportunities and even a lot of sources of grants, a lot of sources of salary. Now, you've mentioned, ma'am, about studying in Singapore. I believe you studied Master in Public Policy there and even offered job in Singapore, right, ma'am? And what I want to just point out is that it's quite inspiring that you still choose to be here in the Philippines despite being offered jobs there. And I am also thankful because we wouldn't have this conversation right now, this very insightful conversation right now, if ever you've settled in Singapore. So thank you, ma'am. I'm quite inspired by that. Now, going to last few questions we have here. Going back to your journey, going back, would you have done anything differently in your professional journey? Can be anything, like a decision you wish you did differently, a thing you wish you could have done earlier or later in your life, something that us students may learn from you or from these things that you will be mentioning.
Um, I think some of you might encounter this later on. When I quit my medical practice, it was very difficult because I think most people who know me at that time would think that that was career suicide, and for a while it really made me doubt a lot about whether what I'm doing is correct. So and that has a lot of impact on the kind of decisions that you do, during that time. So I think the first part is, um, I wish at that time there could have been that support system in terms of quote unquote alternative careers at that time. But I would not really call it alternative career. It's really a career where you want to do things differently and you want to solve problems in a different way. So actually, like the work that we are doing in IHO is that, no, because a lot of us during that generation felt that we wish we could have had that support system. So for people who feel that they don't really fit into what people will call a traditional career, how can you shepherd these people into alternative careers without them losing faith into what is driving them to seek out in the first place, like seek out other options where they feel they can contribute more and all that. So I really hope that at that time there was that. So for me now, for our generation, we are aiming to do that. Also, I felt, and for those of you who are now in your undergraduate, I felt that because before I didn't really like research, really. I didn't like doing research. I hated it. Even when I was doing my residency training, I hated it because we need to produce a research. I don't like it. I just didn't like it. It wasn't, my cup of tea. But having been now in the field of policy, and that producing good evidence is very important, and it's a skill that you can actually learn. You don't have to really like it 100%, but it's a skill that you need to work on, because that is life saving, so to speak. Because if you actually come up with the right evidence that can help decisions, it can save lives. So I wish I could have had done more research earlier, because I've done it already a little later in my career. And therefore, if I would do it again, I would probably have done my PhD early on. Because at that point in time, doing PhD wasn't exactly an option that is lucrative. Like, people will say that, you have your master's, then you're okay, you're set for life. But right now, more and more young people actually have PhDs ahead of us. So I will be pursuing that very soon, but then I wish I could have done that earlier. So therefore, for those of you who are really bent already on a career that is problem solving, looking at evidence, you want to teach in the future, you want to engage in research in the future, then plan ahead to do your PhD. Maybe not right away after master's, but do it right away, because it's quite difficult to do it already at the point of your career where you're raising a family, you have you have to maintain a job and all that.
Thank you so much, ma'am, for that. Really, there are things that we need to consider here when we are working in public health in health policy and administration, in that it's very inspiring also, ma'am, that you took a leap of faith, even if you're already practicing medicine and you know that that job is somehow given high regard in the Philippines specifically, but then you diverted to another field, and look at your CV right now, ma'am. It's very inspiring, very comprehensive, very you know that we know that you have achieved a lot, and right now you're using those achievements to inspire other people to take this job, to take this opportunity, because this is needed in our country. I think, ma'am, that ends our interview. Thank you so much for being with us today, Doc Kathy, for giving us your time and sharing with us your knowledge on the career opportunities in the Department of Health Policy and Administration. I must say it gave me new perspectives in this field, things that I don't know before. Thank you so much. It was very informative and inspiring talk once again with Dr. Catherine Ann Villarreal. This is Rupert for ALAB Radio. See you in our next episode of Trip to the Future. And until then, may you continue to seek your fire within.
ALAB Radio Trip to the Future is an initiative by ALAB College of Public Health in coordination with UP Manila CPH Student Council and UP Hygiene Society. This program is in partnership with ISEC, University of the Philippines, Manila, Alliance of Public Health Athletes, CPH Hydro, Public Health Artists Circle, Progressive and Responsive Organization of Pharmacy, Industrial Pharmacy Honor Society UPCP, CBOL PH, Staff CPH, in cooperation with UP Biology Majors Association, UP Manila Classical Ensemble, UPM Peer Empowering Peer Society, together with our media partners, SparkUp and WhenInManila.com.